Grace, you and I also have a history together. I believe you helped me crash a pediatric ID dinner at one point. I don't know if you remember that. But honestly, I have witnessed your tremendous impact on public health. I really admire your talent for engaging all voices in a discussion and bringing diverse stakeholders together for a common goal. We can all learn from your example. So once more, as Grace comes to the stage, please join me in congratulating her.
Wow, okay. And I'm finding this more terrifying than running an ACIP meeting, so I just want you to know. But we're going to go for it. So I want to say thank you so much for that very kind introduction, for the nomination, Patsy. I'm so grateful, and I also want to congratulate my fellow awardees, Ego and Seth, for the incredible work. I'm humbled to be up here very much. I want to thank the National Foundation for Infectious Diseases for this incredible honor. I wanted to start with a moment of gratitude for my mom, Hija, who's in the audience. I have to say, this was the best dinner to bring her to. My mom is so proud right now. She flew out from Chicago to be here. My sister Joyce rallied from Michigan to help support my mom and myself. And I also want to thank my dad, who passed away 12 years ago. But he would have loved this. It would have been great. I also want to take a moment to thank Josh, my husband of 23 years. I actually had to calculate that out because I wasn't sure. I got it right? Okay. Who managed to anchor our family throughout, even as we were both actually responding to the pandemic in our respective roles. Josh and my two girls, Naomi and Abby, kept me connected and whole, even when the world felt like it was falling apart. I also want to thank my friends and colleagues who traveled all the way out to DC to be here tonight. I think they were surprised that they were in the video montage tonight. So a special shout out to Andy Shane and Caroline Quach. And my colleagues from PIDS, SHE, IDSA, and CDC who are in the room. I told Patsy I had to admit that I was a little bit stunned when she called me and shared that I would be receiving the John Utz Leadership Award. And then I looked to see who won the past awards, and then I was shocked because these are like true giants in the field of immunization. So I'm looking at Bruce Gellin, Walt Orenstein, and Shookit, who I saw in the room, Larry Pickering, Bill Schaffner, Carol Baker. I mean, these names are names that I grew up with and respected and looked up to all throughout my career. So it made me wonder how I got here. And the best way I can describe it is that a famous quote that says that leadership is a journey and not a destination. So in the early part of my journey that I actually didn't know I was taking, I was really fortunate to have wonderful mentors, and I'm going to call out a couple people who you may not know, but they impacted me very much, Rich Platt and Tracy Liu, who opened doors and gave me opportunities to learn the technical skills I needed to design, implement, and lead near real-time influenza vaccine surveillance, safety surveillance in the CDC's Vaccine Safety Data Link program. When the H1, and also the FDA's PRISM program at the time, when the H1N1 pandemic emerged the following year, this was supposed to be my fun project because I was just learning how to do safety surveillance. The next year H1N1 hit, and we were actually ready to contribute to the interagency effort to monitor H1N1 vaccine safety. But it was around this time that I started to become a keen observer of leaders and teams and began to realize that the technical knowledge was not enough. Rather, the success of our work or any work in a complex system that you may work in, was critically dependent on integrating both the social and the technical components to enable change. I have had so many mentors, including some of you in the room, who may not have realized that you were actually teaching me, by example, how to lead and build social capital. And I saw Denise somewhere, but I'm just going to call her out too, because there was a moment during my career where she called me into her office and everyone thought I was in trouble, but she just sat down with me and just talked to me for an hour, and I value that conversation and remember it forever. When the COVID-19 pandemic arrived in 2020, I was serving as a member of the U.S. Advisory Committee on Immunization Practices, and while I was prepared for certain challenges, such as the need to reestablish a coordinated interagency approach to enable real-time COVID-19 vaccine safety surveillance, I was actually quite surprised by the other challenges. So first, I knew that the data would be constantly evolving. I had not, however, anticipated that everyone, even folks from entirely different fields, outside medicine altogether or public health, would suddenly develop overnight expertise on how the COVID-19 pandemic should be managed. And they spoke with authority about it. Second, the public health emergency did not last a few weeks or a few months. It lasted for over 3 years. And during that time, as chair of ACIP, our committee had the opportunity to work as Bill, who I don't know if he's here, but his voice is always a part of NFID, under 2 administrations, 3 CDC directors, and 2 executive secretaries, while we onboarded 2 groups of ACIP members virtually. Third, while we saw vaccine hesitancy before the pandemic, the scale and spread of mistrust in science, scientists, and public health servants, and these are people who are incredibly dedicated, who are just trying to save lives, just added to the burden of managing the pandemic itself. We were also faced with managing trust. So faced with this crisis, I realized that the only thing that I could control was how we as a committee responded. Our role was not just to review and understand the data to make a recommendation about the use of vaccines. It was also to ensure that we highlighted the importance of data transparency, how our individual values influence the interpretation of that data, and how the ever-changing context of the pandemic informed our decisions in that moment, and that things could change. And I began to realize that my role as chair of ACIP was to create a culture where people felt comfortable speaking up and expressing divergent viewpoints in front of a virtual audience of up to 50,000 people before a vote happened. My hope was that the committee, our colleagues, and the public trusted the process, even if they disagreed with the outcome. I am so grateful for this experience because even if we weren't a team that always agreed, we were a team that worked well together in the support of our larger mission to advance the health of the public. And since the pandemic, partly I've blocked it out, but partly I started to shift my mindset too. And now I'm starting, although I think my husband might disagree, but I'm now starting to look at challenges as a gift and an opportunity to contribute and to serve. So let me end by thanking my family and friends once again for being on this very unanticipated journey with me. I wanted to thank the NFID for leading and supporting the ongoing difficult work that's needed to build and rebuild trust in science and in public health. And to my ID and public health colleagues for the frontline work that you do every day to keep people safe and healthy. I am humbled and honored to be part of this wonderful community. Thank you.